Welcome. Welcome to HIP, which stands for Health Insurance Personalized. This is Consumers Doctor on the behalf of Foremost Organization. I've been talking a lot about public-private partnership. How does that work? Public-private partnership. Folks, this is the only way we can cut down the cost of the healthcare through public-private partnership. It doesn't cost the government a penny. It doesn't cost. The way it works is public-private partnership will appoint a health review authority. So let's talk about health review authority. Creation of the health review authority provides a fair segmentation of risks and empowers consumers initially rejected for health insurance. They're so-called uninsurable. Health review authority. Let me explain to you what it is and what it is not. Health review authority empowers you, the consumer. It levels the playing field between you and your insurance company, so-called insurers. It levels the playing. That's why it's called consumer-driven, personalized healthcare, folks. Let's talk a little more about health review authority. So a major part of the personalized health insurance, individual or a small group, is the creation of this health review authority. This public-private partnership is a hassle-free alternative to Obamacare, which tried to coerce power of the federal government on individual consumers. They tried to basically mandate it for everybody to participate. This is totally the other way around. Basically, what Obamacare sought to force the insurers to accept all applicants through government mandates, and the promise to reimburse the insurance companies for any losses. So they try to give a guarantee to the insurers. That's what they are doing for the Medicare, so-called Medicare Advantage. They are giving the funds to the private insurance companies, and where the consumers are lost in the middle. Consumers have no control. Even on Medicare Advantage. Medicare Advantage is not Medicare. Basically, what Medicare is doing is giving the funds to private insurance companies for them to take care of your health care. The same way Obamacare tried to do is guarantee the insurance companies for them to provide the care. It boils down to the same thing what they have done under the Medicare Advantage. So there are middlemen. They try to control the consumer's health care. What I'm suggesting is consumers should be in the driver's seat under the public-private partnership. Before Obamacare, when an individual or a small group employer applied for insurance, they didn't know whether they would be accepted. Personalized health insurance solves that problem, folks. It solves that problem. First, Health Review Authority will review both individual and small group applicants rejected by the participating insurance companies. Rejected applicants will be segmented by risk, segmented by risk to determine whether who is insurable and who is not insurable. So, Health Review Authority determines the applicant is indeed insurable. If the Health Review Authority determines the applicant is indeed insurable and was originally inappropriately rejected by the insurers, that person will be given a certificate of guaranteed coverage. Certificate of guaranteed coverage. Once that applicant gets the coverage, he can go to any participating insurer. They will be able to provide the insurance and the premium according to the economic status of the individual or families. For some reason, if the person is determined to be uninsurable, they will be given access to government subsidized premium impaired health support plans, folks. What will happen if the person is truly uninsurable by the Health Review Board, basically they get government subsidized premium impaired health support plans. They will be available for uninsured individuals and those uninsured within small groups. A second consideration is for the financial support. It will, even for the individual applications, employers will continue to subsidize premiums as for the other employees, even if the members are segmented into impaired health support plans. So basically, the Health Review Authority determines the status of the individual applicant. If they were originally rejected by the insurers, they can go directly to the Health Review Authority. They will guarantee the coverage, and the insurance companies are obligated to take this applicant. So personalized health insurance uses Health Review Authority to identify and segment impaired health risk for a special support. This language is very important. No one wants to be labeled as a high risk, but most want to support for their impaired health. So this is very important because these people, so-called impaired health support group will get subsidized premiums from the government, either federal or state. By identifying and subsidizing the impaired health risks, the premiums for others would be expected to be lowered by 15 to 20%. What happens is when you segment the risk into the impaired, when I'm talking about segmentation, it works like there are 4 categories, folks. Well category, at-risk category, chronic illness category, and catastrophic. Let me explain to you how this segmentation works. Well risk category, 63% of the Americans who have physically fit, they have no ailments, there are only 12% of the claims among the 60, so they should be grouped separately as well category. The premiums have to be based on that. Whereas at risk means people who are smokers, drug addicts, mental illness, hypertension. These are people who are at risk. Those should be grouped together as at risk or acute illness category And even their premiums can be lowered based on the incentives and rewards within that system. What is the third category? Which is a chronic illness category, folks. Chronic illness category. There are only 18% of the folks have chronic illness. The entire population, 18% with chronic illness like diabetes, hypertension, heart failure. Those are the people we need to focus. Those are the people we really need to focus on. By identifying the chronic illness category, the rest of the folks will have lower premiums, and people are impaired. Once you segment it, the rest of the folks, their premiums should be lowered. But right now, it's not like that. So Health Review Authority will establish standards, of insurability and oversee and manage impaired health support plans. They oversee and manage impaired health support plans. For public administration and oversight, Health Review Authority under the public-private partnership will operate under the authority of State Department of Insurance at the federal level, under the U.S. Department of Health and Human Services, folks. Health and Human Services. This beauty about this market-based approach is it is voluntary, folks. It is voluntary for consumers and insurers rather than a government mandate. A system of incentives will encourage insurers to participate. It encourages the insurers because by participating, they get a more membership drive into that insurance companies, folks. Insurer incentives sound like Obamacare promised to the insurance losses, but you're giving incentives to the insurance company. No, only actual individuals with impaired health issues will be subsidized, not to insurers. It will be subsidized, not insurers. So the incentives for the insurance companies that participate will be to take care of the impaired health lives into government premium subsidized plans. This will allow participating insurer to sell their policy to remaining individuals and smaller groups at a lower premium. Yes, basically, government is subsidizing for the impaired health support plan, but the rest of the folks, they can lower the premium. They will be lowered by 20%, folks. You'll be wondering, will the insurance companies be mandated to use identical selection and underwriting standards? The short answer is no. Let me pose that question again. You may be wondering, all the insurance companies will be mandated to use identical selection and underwriting standards. The answer is no. Each participating insurer or insurance company is sets its own standards for risk selection. Application for health insurance might be acceptable to one company, but not the other. Instead of a mandate, insurers or insurance companies will find certificate of guaranteed coverage a compelling reason to voluntarily change their individual and small group underwriting standards to accept more applications. Certificate of guaranteed coverage solves the potential selection differences, folks. It solves the potential selection differences. Health Review Authority will create a fair market by empowering the consumer. In fact, just the presence of Health Review Authority and the power to issue certificate of guaranteed coverage will make a difference in how insurers or insurance companies accept health insurance application. It will really change their so-called risk analysis towards the individual applications. Individual or small group private market cannot exist if an insurer abuses the selection process by accepting only the young and healthy. This was a major problem before Obamacare, folks. This was a major problem. They were selecting young and healthy folks, and people who are sick, they were denying them. Especially individual policies, some insurers would cherry pick individual applicants who are healthy and young. So before Obamacare, you and I know recourse to rejection of our application for insurance, but under the personalized health insurance, you and I are empowered to get what we want at an affordable premium by risk segmentation, and also Health Review Authority will be an agency which will monitor individual applicants. Not only that, it will also monitor the individual groups, it will monitor the insurers, it will monitor the insurers' rejections and denials of individual applicants. So there will be a enforcing power in between the individual and the insurance company. So individual applicant is more empowered under the Health Review Authority, folks. Individual applicant, all Americans will be more empowered and will be paying more attention to the people who are impaired physically or economically. This is the way the Health Review Authority works. That is the beauty of creating a Health Review Authority. Provides a fair segmentation of risk and empowers the consumers initially rejected from health insurance companies. So they were uninsurable to begin with. Health Review Authority will solve that problem once for all. Thank you for listening. Thank you for joining this HIP Health Insurance Personalized Consumer-Driven Healthcare sponsored by foremost organization. This is Consumers Doctor.